Do you have an autoimmune condition like Hashimoto's thyroiditis, ulcerative colitis, Crohn's disease, psoriasis, rheumatoid arthritis, or lupus, and you go to your doctor and they give you medication that kind of suppresses your immune response so that you don't get flare-ups? Have you ever wondered why you actually have the autoimmune condition? Have you ever questioned, is there something that you can actually do to prevent that from getting worse or avoid having to take immunosuppressive medications long-term? Well, I'm Dr. Barrett. I'm a board-certified plastic surgeon, and you might be wondering, like, what the hell do I know about autoimmune conditions? Well, when we do implant surgery, sometimes people can get what's called breast implant illness, and there's a lot of things related to the immune system that can affect that, in my opinion. One of the things I try to do is interview my patients about any autoimmune type symptoms that they have. I feel like if somebody already has some type of autoimmune symptom, they might be at a higher risk for getting that. Through research I've done on my own and through some symptoms that I was having on my own, I had some lupus antibodies and a lot of gut and digestive issues. I did a lot of research and I learned a lot of things that I didn't learn in medical school. There was a podcast by Dr. Isabella Wentz that I listened to where she talked about Massime. She's known as the thyroid pharmacist. You should definitely check her out if you have any kind of thyroid conditions. And she talked about how she cured her Hashimoto's thyroiditis by taking digestive enzymes. And I was like, that doesn't make any sense to me. What the hell is that? And so I listened to her podcast and then it clicked and it made sense. And I want to share this with you because I've had patients who have listened to some of the things I've recommended for them in terms of digestive enzymes and a Biome Breakthrough product that helps heal your gut. And they've cured their rheumatoid arthritis. I had a patient come back after 4 months. She's like, "Doc, my boobs are great. Thank you so much, but you cured my rheumatoid arthritis." I'm into alternative medicine. I'm not here. I don't charge people for this kind of stuff. It's just kind of comprehensive when I go and I give people advice to help them optimize their health during surgery, right? Because if you're coming in and you have a lot of autoimmune symptoms, we like to get that under control before we do major surgery on you, right? Makes sense. So here's what happens. Here's why your gut is related to your immune system and autoimmune conditions, at least for the majority of them. When you eat food, okay, if you have a very disturbed gut or leaky gut is what they call it, meaning that the junctions in your gut lining are loose, okay, so like food particles can go through. Now remember, your gut lining is a single cell and they have these tight junctions next to them that are very well regulated. And if they're damaged through eating a bunch of inflammatory seed oils or things that you're reactive to or heavy drinking, stuff like that, or even taking NSAIDs like ibuprofen and Advil and even Tylenol can disrupt that lining. It loosens that cellular membrane and that junctions between those cells so that big food particles can get through. Now that's kind of a problem because if you eat, let's say for example, if you eat peanuts, you chew your peanuts, you start to digest them, you start to break them down in your stomach, and then when it gets into your small intestine, you still have big peanut protein particles, peanut particles that still need to be further digested, okay? If one of those big peanut particles gets into your bloodstream and travels around, yes, it causes a generalized inflammation, right? Because your innate immune system will actually start to attack it and cause a little inflammation, not a big deal. But what you don't want is your more long-term immune system to start recognizing that food particle and forming an antibody to it. Because if you get repetitive stimuli in your bloodstream from a particular type of protein or molecule, your body will form antibodies to it. And that alone is not a big deal, but it's when that antibody recognizes a peanut protein, but all of a sudden it also recognizes your thyroid, that's where you start to have a problem. Or it automatically recognizes your blood, which is lupus, recognizes joint surfaces, which is rheumatoid arthritis, or recognizes your skin, which is psoriasis. That's where you start to have problems. You have this mimicry going on in your body where you're forming antibodies to a bunch of different things because your gut is just letting all these food particles in, and then it's a shotgun approach. Sooner or later, one of those antibodies is actually going to recognize something in your body and is going to start attacking it. And that's the foundation of autoimmune, is your own body is attacking things, and you need to stop that stimulus from creating more antibodies or even creating antibodies in the first place. What Isabella Wentz talks about is taking digestive enzymes, and that makes sense. As we get older, we actually stop producing a whole lot of digestive enzymes, and a lot of the toxins in our food actually destroy our ability to produce digestive enzymes. So supplementing with digestive enzymes can help a tremendous amount because it breaks down the food particles more so you don't have the immunogenicity. So like the particles that you're eating and that get into your bloodstream, they're at least broken down particles that are not going to stimulate as much of an immune response, okay? That's step one. That's kind of like a Band-Aid on it, right? So it helps kind of break that down a little bit. And then the next one is actually doing things to kind of repair your gut lining to prevent leaky gut. The one product that I actually came across that does a great job, you know, obviously probiotics, prebiotics are really good, but is IgY Max, okay? There's a product, there's no sponsorship here. It's called Biome Breakthrough by Biooptimizers. It's a great company. Is one example where they combine it all in there. But it's the IgY Max that kind of heals the gut lining. Okay, it's a specific immunoglobulin that allows those tight junctions between the cells to form up, and that you don't leak a bunch of food particles into your bloodstream prematurely, right? You do want to get the food into your bloodstream, but you want to break it down into the basic molecules that we use for metabolism. So those two things I recommend if you're having some autoimmune types of conditions. You can get the products on my website, postoprecovery.com. You can also get it on the Biooptimizers website. You can actually get a bunch of different digestive enzymes. Masszymes is one I recommend. Seems to work really well. And then the other is the Biome Breakthrough, which has the IgY Max, or you can actually just look up what IgY Max is and order it directly. In addition to that, you know, from my personal experience, I used to have about 30 different types of food sensitivities. I started on those products, I got it down to about 5. And then in addition to that, I did some fasting to heal my gut. It's been years since I've taken Advil, Aleve, ibuprofen. Those things are very damaging to your gut lining. And I barely drink anymore, rarely. And I've found that my gut health has dramatically improved and all my food sensitivities have pretty much gone away. So with the combination of these products, fasting, really being careful with what you eat, you might be able to improve your autoimmune symptoms and be able to get off of some of those medications that you have to take to suppress that, right? Because if you suppress your immune system, you're also suppressing a lot of other good things that your body's doing, like cancer monitoring and cancer fighting molecules like natural killer cells and things like that. You definitely don't want to be on those things long term, so if you can discover ways to reduce your dependency upon them, you'll see some improvement in your overall health. So that's it. If you got any questions about it, leave me some comments down here in the comment section. I know this was a long one. If you like what you saw today, feel free to give me a thumbs up and hit subscribe. Thanks for watching.